Hi everyone, it's Dr. Gina Joe, or Dr. Gina Jefferson, Professor of Otolaryngology, Head Neck Surgery. So in this video, I plan to discuss strategizing your third year clinical rotations for you second year medical students that have aspirations of becoming surgeons. I do realize that depending upon the medical school, some of you may not have any control over the order of your rotations, but don't worry, I have tips for all. Tip number 1, many of your medical schools use a lottery system or some similar mechanism for ordering your core clinical clerkships. My advice for those interested in surgery or surgical subspecialty is to optimize your chances for doing a medicine clerkship early or first. The advantage of doing medicine early and before surgery is that the medicine rotation will strengthen your core medical knowledge and serve you well in participating in the care for sick surgical patients down the line. Another advantage of doing your internal medicine rotation early or before surgery is that it allows you to familiarize yourself well with the system of the hospital in which you work. This will enable you to efficiently work during your busy surgical rotation. Tip number 2, for those of you interested in a surgical subspecialty, try to arrange the general surgery core prior to the subspecialty electives. This will allow you to gain some skill in knot tying and suturing, in addition to learning how to identify problems with the surgical patients, as well as basically just thinking like a surgeon. Tip number 3, make sure you develop a strong or solid study routine for all core surgery rotations, and that includes OBGYN. If pursuing surgery of any kind, we are ultimately looking for honors in all core surgery clerkships of any kind at a minimum. Tip number 4, make sure that you plan to utilize any and all downtime strategically during your third year. That means making early relationships with residents in surgery that you are interested in pursuing so that you can contact them to ask if it's okay to join an OR during your downtime. Making yourself visible and demonstrating interest is key for matching down the line. Don't worry, if your surgical clerkships do not shake out in the order that you want, you will succeed in your surgery aspirations with due diligence and hard work. If you find my tips helpful, share them with your friends and continue to follow me at Dr. Gina Joe on Instagram, and you can also find me on YouTube.